What valve lies between the left atrium and the left ventricle? The mitral valve. Which of these vessels sends blood into the right atrium? Coronary sinus. Where does blood flow after it has returned from the pulmonary circuit? Left atrium. What structures help prevent backflow through the AV valves? The papillary muscles. The papillary muscles are connected to the chordae tendineae, and they prevent those cusps from stretching backwards into the atria. When the heart beats, the AV valves close before the semilunar valves open, and the semilunar valves close before the AV valves open. When the ventricles are relaxed, they fill. Those AV valves are open, the chordae tendineae are loose, the semilunar valves are closed. Blood pressure from the pulmonary and systemic circuits keeps them closed. This is showing the position of the heart valves while the ventricles are filling. You can see that the AV valves are open and the semilunar valves are both closed. When the ventricles contract, they empty. The AV valves must close to prevent backflow into the atria. Pressure from the contracting ventricles pushes the cusps together. The papillary muscles tighten the chordae tendineae so the cusps can't invert into the atria. This prevents backflow, also known as regurgitation. The semilunar valves open, and so that blood can flow out the aorta as well as the pulmonary trunk. This is showing the position of the heart valves when the ventricles are emptying or during contraction. So during contraction, both of these AV valves are closed and the blood flows out. This is oxygenated blood, so it would be flowing out of the aorta. And this is deoxygenated blood, so it's on its way to the lungs. The cardiac skeleton is a fibrous skeleton. It's just connective tissue. It surrounds all of those valves. Just isolates them and just stabilizes them. The pulmonary and aortic valves are different from the cuspid valves. They are called semilunar valves. Each has 3 half-moon shaped cusps, and it prevents backflow. Valvular heart disease is when the valve function deteriorates until the heart cannot maintain adequate blood flow. With a malfunctioning valve, blood would backflow. There may be congenital malformations, that is, you are born with these malformations, or heart inflammation called carditis. Severe cases may require replacement with a prosthetic valve, and we have bioprosthetic valves that come from pigs and cows. Where are the AV valves located? Between the atria and the ventricles. Arteriosclerosis is hardening of the arteries. The artery walls get thick and tough and less flexible, and complications of arteriosclerosis account for about 1/2 of deaths in the United States. Coronary artery disease is arteriosclerosis of the coronary vessels. Arteriosclerosis of the brain can lead to a stroke. Atherosclerosis is a form of arteriosclerosis. It is the formation of lipid deposits in the middle layer, the tunica media, and it also damages the endothelium, the inner layer. That inner layer is also called tunica intima. This atherosclerosis is the most common form of arteriosclerosis. It's associated with high blood levels of cholesterol. And you can see how there is lipid deposits here or plaque. And what it does is it's going to narrow the lumen and increase the pressure. Risk factors include age, if you're elderly, sex, if you're male, not if you have sex, high blood pressure, high blood cholesterol, and cigarette smoking. There is treatment for atherosclerosis. That section of the vessel could be replaced, or you can put in a catheter with a balloon. And once the catheter gets into that blood vessel, you inflate the balloon. The balloon opens up in the blood vessel and pushes the plaque against the artery walls. It's just kind of opening it up. This is good for small, soft plaques, low mortality rate, and very high success rate. But you can imagine if you don't change your lifestyle, and maybe even if you do change your lifestyle, that plaque has just been pressed open. It could come back. Coronary artery disease is areas of partial or complete blockage of the coronary circulation. So remember, we really only had to learn the right and left coronary artery and the coronary sinus, and it is the coronary arteries that are often the problem. What happens is there will be, if there's blockage in that artery, there will be reduced blood flow to the area, and that reduced blood flow is called ischemia. You may have had that if your arm or leg has ever gone to sleep. It will cause pain. Usually this is from atherosclerosis in a coronary artery or a blood clot called a thrombus. And you can see this with different types of radiography, and you can treat that with a mesh stent. So on the left is a picture of healthy coronary arteries, left and right coronary arteries, and on the right is reduced blood flow in those coronary arteries. And this shows a stent. These pictures are not of the vessels, but this is actually of the lumen. So here's a stent inside the blood vessel to keep it open. What is an anastomose? Arteries that form connections as alternative paths. Which of the following would be treated with balloon angioplasty? Atherosclerosis. The cardiac cycle is a complete round of systole and diastole. Systole means contraction, and diastole means relaxation. So the cardiac cycle is the period between the start of one heartbeat and the next, and the heart rate is the number of beats per minute. And both atria are contracting at the same time, and both ventricles are contracting at the same time. The cardiac cycle consists of two phases, contraction and relaxation. In contraction or systole, the blood leaves the chamber, and in relaxation or diastole, the chamber refills with blood. there is a sequence of contractions. The atria contract first. That would be called atrial systole. They push the blood into the ventricles. At that time, the ventricles are relaxed. When the ventricles contract together, ventricular systole, the atria are relaxed. The typical cardiac cycle lasts about 800 milliseconds. I don't think numbers like that are necessary to learn. What term refers to contraction of the heart? Systole.